Yeah, thanks very much. It's great to be here. I'm a retina specialist, and my area of research focuses in imaging and AI. And there've been a lot of advances in our field, but also a lot of areas that we could improve upon. We still don't have treatments that are effective for many different conditions, inherited retinal diseases. There's a lot to be done there, as well as even macular degeneration and diabetic retinopathy, which are obviously the leading causes of blindness in many countries, at least when it comes to retinal diseases. I'm very excited about the advances in diagnostics such as imaging because they have given us, I think, amazing insight down to the cellular level about disease, because we need to find better targets for these diseases. And I think that when we have these new technologies, we get a lot of data. And that's what AI has really been, I think, quite spectacular at, because it allows us to make sense of all of this data. So there's been a great marriage between these technologies, I think, coming at a perfect time to try to address some of these areas of unmet need in our field. Well, I think that one of the biggest challenges, obviously, our population is growing, and I think the rate of growth in some ways may be outpacing the number of clinicians and others who are producing to take care of our growing population. We also have certain diseases because our population is growing in part also because we're growing to be older, we're living longer. Which I think is a good thing. There's many aspects of health that have improved, but with that come other diseases. I mentioned earlier about macular degeneration. Well, that's rising at a tremendous rate. Also, we do have some problems related to this epidemic of diabetes with people, although they may be living longer in some ways, they may not be as active as they need to be. And so diabetes is on the rise, and so more diabetic retinopathy and issues of that sort. So one of the challenges is how do we get more care to people? This is again where tools like AI and screening technologies using imaging are going to be quite important. We also have to be able to deliver care to more remote areas. So we, not only do we have a growing population, we also have an inequity in terms of how physicians are distributed across the world. And there are many areas where people have to go to a very long distance to find medical care, and it's a big challenge. So I think those are some issues that we'll have to address in the coming years. Yeah, ARVO, I think, is a very key organization. It's an international organization related to vision science research. And the critical aspect of ARVO is it brings together clinicians, basic scientists, engineers, all sorts of individuals working in vision science from across the world. And so that's a critical thing because really to solve some of these big problems that we've highlighted just briefly, we really need to have global collaborations. And that's really what ARVO fosters. Its mission is really about fostering this type of global vision science research and exchange to more rapidly advance progress in our field to address these many challenges that we face.